How you doing? My name is Reid Forte, and I'm here to speak to you today in regards to bill number CS/HB291, which is going to be the prescription drug donation repository program that is said to be introduced July 1st, 2019. So the reason for me speaking to you today is our goal is to receive funding to take this bill from the voting phase to the implementation phase. So with this bill, we are going to take drugs from pharmaceutical companies that have not been sent out to pharmacies, that have not been part of an order. Essentially, these drugs will either be destroyed, thrown away, they will not be used. So pharmaceutical companies are not technically losing out by doing something with these drugs. These are already drugs that they're planning on disposing of. So basically, they're going to take these drugs, which have never been sent out, never been part of an order, and they're going to donate them to pharmacies across the nation. And what these pharmacies are going to do is they are going to give these drugs away to people for free of charge, who cannot either afford their medications, do not have means to access these medications, but they need and require these medications for lifelong chronic illnesses that they have been diagnosed with. So some of the rules and the guidelines behind this program is the drugs that they're going to have, they're going to have to be in the original container, no signs of tampering. They're going to include the original lot numbers, the expiration numbers, just like any medication, normally would in a hospital or in any healthcare environment. These drugs cannot be donated to specific patients. They can't favor a certain population, a certain patient. No family members, anything like that. It's just going to be widespread. They're going to try to disperse them as evenly as possible, as fair as possible. And they're not allowed to use any medications from companies that have been funded by Medicaid. Now, all those this is directly from the Florida Senate. This is in regards to this specific bill. The bills will allow the dispensing by pharmacists and other healthcare practitioners authorized by law to dispense prescription medications and supplies. The bills would also offer legal protection to these pharmacies. So if there's any side effects, any negative side effects, no pharmacy will be responsible. If there's any, if there's any adverse reactions, these pharmacies are not going to be held responsible. These medications are all going to be FDA approved. They're all going to come with their list of warnings and side effects, just as any medication normally would. So the main thing that I believe that this bill is going to help with and why we would like to receive funding is medication adherence or medication non-adherence is a major problem in the United States today. In 2010, the estimated costs of medications exceeds $2.7 trillion. And this is from an article I read, Adherence and Healthcare Costs. So $2.7 trillion, that is a huge number, and that accounts actually for 17.9% of the gross domestic products. That would be medications produced by pharmaceutical companies. They estimate 20 to 30% of those dollars spent, 20 to 30% of that 2.7 trillion has been identified as wasteful. This is due to medication adherence, or lack thereof, medication non-adherence. So there was a review by the annual internal medicine, which estimated that there was a lack of medication adherence caused 125,000 deaths. It was responsible for approximately 10% of all hospitalizations within that year. And that's already straining that's adding to the cost of the already strained healthcare system. So they're estimating this medication non-adherence is contributing between 100 to 300 billion dollars out of that 2.7 trillion. So we're asking for funding. Yes, we're asking for a large amount of funding for this bill, so we can promote it, so we can get it to the implementation phase, and so we can get it out there to give these medications to the public. But if you look at what we're getting back as far as our healthcare system, that's roughly 1/8, 1/8 of a million people. We would be preventing 125,000 deaths per year, freeing up hospital space, 10% of hospital space. If you attribute that to every hospital, that's a 10% decrease in bed space that you're taking up. That's a big problem right now in the United States is, wait times. Hospitals are at capacity. We don't have the means to treat the people that we need to. The nursing staff, we're already at a nursing and physician shortage. So, by implementing this bill, we're hoping to increase medication adherence, decrease hospital admissions, free up some of the space in some of these healthcare facilities that we don't previously have. So with these medications, they say that roughly 1/2 of the adult population, about 50%, has been diagnosed with at least one chronic disease. And of these 50% that are diagnosed with a chronic disease, they say roughly 38% of those people are on at least one medication that they take year round, that they are required to take. And that came from the exact the adherence and healthcare costs article that I was speaking of earlier. So the article also finds that in reference to the advocacy efforts to improve medication adherence, 20 to 30% of medication prescriptions are not filled. So out of those 50% that are diagnosed annually with a chronic disease, out of the 38% that are required to take a medication yearly, 20 to 30% of those medications are never filled. And approximately 50% of medications for chronic disease are not taken as prescribed. So again, that's going directly back to medication non-adherence. And it ends up being a vicious cycle. So when you have a patient, poor medication adherence, it's going to lead to a poor health outcome. You're going to have a decreased quality of life and potentially quantity of life. The years that you live could possibly be decreased due to the impact of not taking your medication. You're also going to have an increase in your service utilization, which is going to be, your hospital admissions, your increased costs to the public from these healthcare expenses. People that come in without insurance, maybe that's the reason that they can't take their medications to begin with. Maybe they can't afford them. So our purpose with this bill is to give back to these people, to give them these medications that would otherwise be destroyed. Pharmaceutical companies aren't going to benefit from destroying these medications. They're not going to get perks. They're not going to get buybacks. They're not going to get anything else. They're the ones making them. So this money is already being thrown away. So why not donate them to a better cause? After the increased service utilization, we're also going to have the increased healthcare costs that I just spoke of. And more than likely, healthcare facilities and pharmaceutical companies are not going to eat these costs. These costs are going to be passed on to the patient, and then we start back over. You have an increase in your healthcare costs. You're going to have an increase in cost to the patients for medications. And then you're going to head back into your poor medication adherence and poor health outcomes. And you're just going to be in this vicious downward spiral. And we need to try to get away from that with our healthcare system today. So there's many reasons that, you could have medication non-adherence. The patient, you're going to have the demographic, the socioculture, and their behavior. All these categories, break down. In the demographic, you're going to have your age, your sex, your education, your employment, your income, family size. With your socioculture, you're going to have your health literacy, your medication beliefs. Maybe people don't believe they need a medication. People diagnosed with diabetes all the time. A lot of people don't take insulin, don't take any of the oral medications to control it. They believe that with diet and exercise, and it has been proven that you can beat or at least maintain and control your diabetes without medication. And then you're going to have your behavioral factors, which can be your cognitive function, your mental illness, your stress, and your substance abuse. Maybe some people can't afford their medication because, they prefer to handle their illness, or they prefer to handle the way they feel with alcohol or other substance abuse, and that's not a good thing either. So also leading to medication adherence, you're going to have your provider. That's going to be your communication, your relationship between provider and patient. And so with that, the patient needs to have a sense of trust. You have to build that rapport with your patient. The patient has to believe that you have their best interest at heart. And that's hopefully what a lot of providers try to do. So that way we can get these patients to understand the seriousness of their chronic conditions and take their medications. And then we have our external factors, which are going to be our disease, our medication, and then our just complete healthcare system in general. So under disease, we're going to have our duration and our response to treatment. So the duration of your disease, is this a lifelong disease? Is this something that we're going to be able to otherwise treat within a few years and possibly get rid of? Things like chemo, radiation, stuff like that. All those drugs will actually be included, chemotherapy drugs, radiation therapies, and all that stuff that they will use for some of those procedures. All that's going to be included already in these medications that we're going to be able to give out to the public free of charge. So with our medications, we're going to have our events, our regimen complexity, and our storage requirements. Some medications require, to be in a cool, dry place free of light. Many different requirements, that information will be passed on to the patients. And our overall goal here is just to give them the means to treat themselves and to help themselves. We can't force them to take these medications. We can give them to them. We can give them all the guidance, all the necessary requirements. Give them a plan. It needs to be taken twice a day. Free of this substance. There's a lot of medications that really interact. With grapefruit juice. No acidic juices. Take this one with food. It can be upsetting to the level of acidity or the stomach lining. And then you're also going to have your other external factor, which is just going to be your system, your access to care, your cost, your co-pays, your health insurance. Some people can't afford a health insurance, and there is other government agencies out there that are, trying to help contribute to that. But this is just another means to increase, or should I say decrease, the medication adherence and non-adherence that we're facing in the United States. So another study that I read, was done, and it was actually published inside of the medication adherence and healthcare cost article. And it was saying that it did two different surveys. One of them included a 10,000 patient population, and most of their reason for medication non-adherence was their forgetfulness. 24% said they just, forgot to take it. There'd be times they just forget to take it for, either their morning, afternoon, a couple doses here and there. Not really many side effects or anything like that. Some medications will have stricter guidelines. Another reason, 20% said that they were worried about the perceived side effects of the drug. 17% said the high drug cost. So there you go. Out of that 10,000 patient population, 17% said that they're worried about increased drug costs. So there's already that's a large majority of that 10,000 that we can already go ahead and knock off of there, due to giving these medications out. And then the perception that these prescribed medications would have little effect on their disease. So if you're giving out medications for free, what incentive do people have not to take these medications? 14 and 17%, 17% said high drug costs, 14% said, why spend the money on this? I don't think it's going to help me. That's 31% right there together that we can have those patients take the medications that are required. The other survey included 14,464 Medicare beneficiaries. And out of these people, 55% said they did not take their medications because they believe the medication costs too high. 20.2% said they did not take their medications because it was not covered by insurance. Now we're at 75.7% out of 14,464 people that we could potentially give back to. That 75.7%, those people are now going to take medications. They're not going to be worried about the cost. They're not going to be worried if the medication is covered under insurance, because we're going to be giving them these medications for free. In that study, the other 18% said they didn't believe it was necessary. So you can actually add that to it as well. If we're giving these people these medications for free, they're going to have no problem taking these medications. They're not going to be worried if, is it really helping? Is it not? Let's give it a try. It's free. What's it going to hurt? We'll monitor for the side effects. As long as we don't get any major side effects from it, hey, we'll go ahead and take it. So really our overall benefit here is just to give back to the public, to help boost, the healthcare system that is being so strained right now in the United States. So our overall goal with this drug donation repository program is just, to give back, to decrease the medication non-adherence, to increase the overall quality and quantity of life in the United States. Thank you.